Hey everyone. I just wanted to give a personal update. It's been a little while, and there's something that I learned that I want to share with everybody going through a medical journey to figure out what's wrong with them, just the same way that I did. If you're new here, I've been talking about my medical journey for the past 10 years. I had a neuropathic pelvic pain issue called pudendal neuralgia. That pain has actually improved a little bit. I had surgical decompression surgery in March of 2020. It was a very long and grueling recovery, and I still have flare-ups of the pudendal nerve pain. But ever since October of 2020, my journey has kind of shifted towards researching Ehlers-Danlos syndrome. This is a connective tissue disorder that affects pretty much every body system to some degree. Some folks have really severe symptoms, and other folks may have like a benign kind of thing going on where they have hypermobility, but they don't have as many internal symptoms as some people do. But it's definitely a really neglected medical condition because there's not really one single specialty that owns this disorder. So it's really hard to find like a treatment plan without a huge team of specialists, whether that's cardiologists, neurologists, rheumatologists, physical therapists, orthopedics, and so on and so forth. The identifying conditions or symptoms, or the most common symptoms of Ehlers-Danlos syndrome, tend to be that people have frequent joint dislocations and subluxations. However, I think moving forward, I'm going to start saying that the most common type or the most common symptom or ailment with Ehlers-Danlos syndrome is pain, chronic pain, whether that's neuropathic pain, nerve pain, stinging, stabbing, shooting, numbness, whatever, or vessel pain. A lot of people suffer from autonomic nervous system dysfunction and mast cell activation syndrome. Autonomic dysfunction, the autonomic nervous system is your unconscious nervous system, so anything that you don't consciously control, such as your heart rate, your breathing, your digestion, your temperature regulation, etc. It turns out that nerves and blood vessels don't like to be pulled and compressed for long periods of time. Who knew? So the central nervous system ends up getting involved when you develop tons of micro injuries over time, whether it be from dislocations or just from easy bruising. A lot of us are very clumsy because we have proprioception issues. That's basically like our awareness of where our bodies are in space and time tend to be a little bit wonky. And many folks that are on the journey of Ehlers-Danlos syndrome at some point are curious about DNA testing. And I want to talk a lot about DNA testing in this video because I've been through the ringer with it, and I've learned a lot of stuff about DNA testing. So for those of you who don't know, I'm going to be kind of repeating stuff for folks that know about EDS. This is stuff that everybody's heard before. The most common type of Ehlers-Danlos syndrome is called hypermobile Ehlers-Danlos syndrome. There is a strict physical criteria to qualify for this diagnosis that was created in 2017, and unfortunately that criteria excluded a lot of folks. And part of that criteria is the Beighton test. It's a test out of 9 points. It tests joint hypermobility in 9 different locations. And a lot of folks that have a doctor, any doctor can print out the criteria online and do the Beighton test in office. And unfortunately, this test does exclude a lot of people, but we did need to have some type of criteria on paper for this disorder. And I keep seeing that this criteria is going to be updated. It's still being worked on, and as time goes on, we're going to see that a lot more folks will be included in that diagnostic criteria. So I went to see Dr. Claire Francomano. She's a geneticist at Indiana University. She is one of the top geneticists that works specifically on Ehlers-Danlos syndrome. She pretty much dedicates her entire career to this syndrome, which is very, very rare because, like I said, there's not many doctors who own this disorder, right? So usually you go to a specialist and sometimes they've heard of it and sometimes they haven't. Awareness is being pushed, so a lot of times people know what it is, they just have no idea what to do with it. So if you find a doctor who knows what it is, that's a step in the right direction. However, there is still so much education needed. So I went to see Dr. Francomano, and I had done some genetic testing of my own prior to going to see her. So the first DNA test that I did was through Invitae. Now, Invitae is it's a widely known company. They test for specific genes, and you speak to a genetic counselor through Genome Medical. Now, one of the most common questions I get is, how do you do DNA testing? How do you go about doing this? The first thing I would say to anyone looking for genetic testing or to get started in that is to book an appointment with a geneticist. Now, the reason I say to do that first is because geneticists are super hard to get into. I had to wait 2 years just to get my appointment, and it took me 2 months just to schedule. So it's a long wait. So the sooner you get your appointment, the better. And then if you want to proceed to do some research on your own, go for it. So I did the connective tissue disorder panel with Invitae. They tested for, I think, 7 of the different Ehlers-Danlos types, 6 or 7. I'd have to get my paper out to look at that. They tested for Marfan syndrome, which is another connective tissue disorder that sometimes has overlapping symptoms with EDS, but not always. And then Loeys-Dietz syndrome, which is another connective tissue disorder that has a lot of cardiac symptoms and is very severe. So I did that panel first. Now, like I said before, the most common type of EDS is hypermobile EDS, and there is currently not a DNA test to determine if you do or don't have hypermobile Ehlers-Danlos syndrome. Now, if you don't meet the 2017 criteria for a hypermobile Ehlers-Danlos diagnosis, but you have a lot of the same symptomology as someone with EDS, you are said to be on the hypermobility spectrum or hypermobility spectrum disorder, which is exactly the diagnosis I received from Dr. Francomano. I was 1 point away from receiving the 2017 HEDS criteria diagnosis. So that's my point of contention with that, but I am not alone. I know there are many people like me, and I learned so much from Dr. Francomano, just like little things that she pointed out about me that I didn't necessarily realize I had going in. So it was a great experience. Number 1, get your appointment with a geneticist. Highly recommend Dr. Francomano, but like I said, it takes about 2 years to get into her. Now, there's another geneticist in Indianapolis, Dr. Brad Tinkle, who works with Ehlers-Danlos syndromes. And of course, there are other geneticists that probably can help people determine what their diagnosis is, but they may not have as much knowledge about EDS. But number 1, get your appointment with your geneticist. Now, the other thing that I learned was that Invitae is a diagnostic. They use Invitae for diagnostics, for medical diagnoses. So I went into Dr. Francomano and I showed her the panel I did with Invitae, and she said that this is a great thing to do to simply rule out other types of connective tissue disorder. Now, like I said, the hypermobile EDS does not have a DNA test, so what you are doing is ruling out the other types of EDS that have known genetic markers. The next thing that I did probably a year and a half ago is that I did whole genome sequencing on my own, which looks at the whole genome. And that was a pretty big blunder on my end. And this is the reason I wanted to make this video, is to educate people about whole genome sequencing. Now, most of the online whole genome sequencing products that there are for entertainment purposes only. So they get, they run ancestry reports, and they run cannabis reports, like they look at genes that may or may not interfere with your metabolism of cannabis and CBD and a bunch of other stuff. So I had the testing done with Nebula, a company that does whole genome sequencing. That was the lab. And then I did a rare disease panel with sequencing.com. The rare disease panel tested for like 2,500 different rare diseases. EDS was on there. So nothing showed up on there. But then I ran a wellness report. So what you do is you basically, you create an account with sequencing.com, and you get 2 free apps a month. Now these apps are like different subjects, right? So if you want to do fitness, if you want to do cannabis, if you want to do rare diseases, there's tons of subjects out there that you can pick what reports they run. And so this is this company's way of getting you to pay monthly for your data to remain eligible, right? So they're not going to give you every single piece of information about your genome at one time, because that would be not financially lucrative for them. So they get you to sign up for an account on sequencing.com, and you get information this way. I found out my blood type. I found out like a couple other things. And then Nebula has their own set of reports through their lab, and it shows you which percentile your DNA falls for certain disorders, right? So like Alzheimer's, heart disease, whatever. So like your risk profile, if you will. So that takes a look at, several different genes that there are studies out there, and they link you to the medical papers that say, here are the genes that we think are involved, or we have found through testing, right, that are involved in A, B, C, and D. And they do link you to the medical studies, and it's a really cool resource, right, to see that there are studies out there that you can, they can back up their data with. Now, like I said before, for entertainment purposes only. So I ran a wellness report. It was one of the fitness reports, and there was a gene that showed up as mutated for me, KCNE2, which is involved in long QT syndrome. So long QT syndrome is a pretty serious disorder. There's probably, I think there's 14 or 20 genes that are involved. These genes are involved in coding for the ion channels in muscle tissue. So your heart has an electrical signal that helps it to beat and things like that. And in order for the electrical signal to be effective, ions, sodium and potassium, need to move through the cells in a certain way. And the genes that are involved in long QT syndrome, they code for these ion channels. Now, if one of these genes is messed up, then that means that you have a increased risk of a long QT, which is on your EKG. That's the one of the lines of on the EKG. So heart arrhythmia disorder, so it causes heart palpitations, and you are at increased risk for sudden death. So these people, you cannot scare them. They're at risk for collapsing, so on and so forth. So the gene that showed up for me on this report was involved in long QT syndrome type 6. Some cardiologists or cardiac geneticists are still researching these genes. There's a certain set of genes that they aren't 100% sure that contribute to long QT, but there's 3 types that are pretty serious and severe. But this showed up for me, and I took this information to Dr. Francomano, and she says, do a confirmatory test with Invitae. So, ordering the panels through Invitae was a complete nightmare. No fault of theirs. They had a like an opportunity for a free arrhythmia panel if you can provide sufficient information from your cardiologist. And while I thought I had that information, one of my EKGs did show a long QT, prolonged QT interval. It was just a lot of back and forth, and basically I just keep learning, like, what can I trust these days? You know what I mean? So that was a huge nightmare. So anyway, I got the results back of the arrhythmia panel, and they tested, it was like 30 or something genes that tested for all of the long QT syndromes, as well as a couple other heart arrhythmia disorders. And basically I'm negative throughout the board. So this is interesting to me. So basically the information that I got from whole genome sequencing was completely wrong. Good thing I checked, but it does kind of put this idea in your head, like you don't know what to trust, right? I already struggle with imposter syndrome with my symptoms and with my medical ailments because I spent so long trying to figure out what's wrong with me. And basically every time I get a, it all looks good, or your test came back normal, like, you know, ask anybody in the chronic illness community how devastating that is. And it's hard for people to understand that, you know, why would you want something to show up like that, right? So it's just, it's sort of a grieving process. Like every time you get something back that's negative, that, you know, you thought you were on the right track, and now you figure out that you know, there's more questions than answers. So at this point for me, there's a lot more questions than answers. Yes, it's great that I don't have long QT syndrome, but I was thinking that I was on the path to finding something else. And these things are expensive, and it took so much time. But again, I did learn something here. And this is why I'm making this video, because many people on the EDS journey are asking about DNA testing, right? So if you're going to do whole genome sequencing, please talk to a geneticist, do your research. Don't just be naive and pick just any online company with the cheapest, you know, deal. It was $300 for the whole genome sequencing, right? So don't be like me. I learned my lesson, and I'm here to, my whole purpose for this channel and for making videos and for posting on social media is to raise awareness and to help people. So this is what I'm doing. I'm going to attempt to make a shorter TikTok video about my experience. Usually when I say short video, it ends up being 20 freaking minutes long, and that's where I'm at right now. So if anyone has any questions, please feel free to DM me. My username is AnnOrangeZebra. You can find me on TikTok, you can find me on YouTube, and you can find me on Instagram. Send me questions, comments, and I'll be happy to guide anyone who has questions about DNA testing, Ehlers-Danlos syndrome, pudendal neuralgia. I really enjoy talking to people and helping people and sharing my experience. Thanks so much for watching.